Hello, my name is Robert Brandon Sandor. I want to thank you for watching this video. A little bit about me is I'm HIV positive since the early 1980s, therefore I'm a first generation long-term survivor of HIV. I call myself a victim of HIV, but you have your own opinions. I'm a veteran of the United States Air Force. I was in the Air Force from 1979 to 1983. I have an honorable discharge, and yes, I do have a humanitarian service medal that I received from the Air Force in 1979. Absolutely none of that has anything to do with what we're talking about today, other than the fact that I'm HIV positive in the 1980s. I hear a lot of information out there, a lot of talk about PrEP. PrEP is the wonder drug. PrEP is the miracle cure, and in the past 30 years, I've heard a lot of things about magical pills, magical elixirs and potions, and magic spells to keep HIV negative people negative and to stop the spread of HIV, and absolutely all of them have failed, except for one that has succeeded but has not gotten the attention of the general public until now, and that is behavioral change. I hear a lot of talk about conversation changers. There's one agency out in the Midwest of the United States that their motto is change the story. Well, regarding PrEP or regarding HIV prevention, change comes from within the culture. Change comes from within the community. And therefore, the gay community must understand and be made aware of this cultural change. They need to know that this is a behavioral change. But more importantly, the gay community needs to know what to look for. You can't have successful HIV prevention, you cannot have successful behavioral change unless the culture of the community understands what to look for and where to look for. What are the signs? And more importantly, what are the messages available out there to them? Well, for example, it was back in the mid 1990s. It was back in the mid 1990s that I started sex parties here in the city of New York. One was called Boy Toys New York. One was called Brandon's Pause Parties. Unfortunately, you were not made aware of the other party, which was Boy Toys New York. I do not care if you believe me. I do not care if you agree with me. What I care about is that I do have the original copies as they were published back in back in the mid 1990s and late 1990s. This one's from November 19th, 1999. It's called Next Magazine. And this article that you see right here for Brandon's Pause Parties and Boy Toys New York is posted in the subculture section under parties, and right there for all of you is the date, 11/19, Next Magazine. And it's right there, which means back in the mid 1990s and late 1990s here in the city of New York, there was not one sex party that was based on your HIV status, Brandon's Pause Parties, but there were two, Brandon's Pause Parties and Boy Toys New York. Boy Toys New York was for HIV negative gay men who wanted to have safe sex with other HIV negative gay men. This is called safe sex serosorting. The party was shut down in late 1999 by GMHC and by the health department of the city of New York. Why? Because HIV negative people don't exist, and more importantly, they're not allowed to have sex. However, as the last message I sent out to the mailing list, because I use the internet as a primary source for communication, I told the membership, even though the party was gone, the physical party was gone, the virtual party lived on through the internet. Put into your profiles you're HIV negative and you're looking for other HIV negative gay men or HIV negative UB2. Also what came out of it was D&D free. And once again, I don't care if you believe me or not. That's not the point, because it's been published. This phenomenon was published in Out magazine, and as you can see, this is the April 2002 edition. And if your name is Steve Weinstein, take note. Do you remember your article here? On page 48, right there, Out magazine, and there it is, positive thinking, and there, yes, Steve Weinstein. Let me read a passage from Steve Weinstein's article on page 51. And it says, and I quote, "Certainly many HIV negative men remained concerned enough about their health to enhance their encounters with other HIV negative gay men. Just check out the code words in AOL profiles: safe only, healthy, disease-free, drug-free, HIV negative UB2. It says so right here. If you don't believe me, which is okay, contact Steve Weinstein, contact the editors of Out magazine, tell them to pull up this issue, and you can read the article for yourself. Therefore, in order for this behavioral change to be noticed, and for people talking about PrEP and talking about conversation changers and changing the story, you need to understand that there's something going on far greater in the community, and that is the community is doing this on their own. This is a community-driven endeavor. It's sad that since the mid-1990s and to this day, no HIV agency, organization, expert, professional, or researcher have taken notices to this. They've all turned their backs on this monumental community-driven endeavor, and they have refused to empower those of us who are leading this change forward. PrEP is worthless. PrEP is obsolete. Why? Because if you're HIV negative now without PrEP, you have achieved the goal. You have succeeded in stopping HIV. What is missing from the formula? You are not empowered. You are not supported to remain HIV negative without medications. Otherwise, you would be hearing more about this disease and drug-free and all these other things, just as it was posted more than a decade ago. So where can you go today to find this information? Simple. Go to HIV-negative UB2.net, the nation's first and largest HIV negative support network. There's resources. Click on the resources button and you'll find a lot of information there, because somebody needs to speak up for our nation's HIV negative gay youth. And if I don't, who will?